These high incidence areas have experienced several-fold higher rates of cases, hospitalizations, and deaths than North Seattle shoreline, the East Side, and Vashon Island. And that is an ongoing trend throughout this outbreak. Hospitalizations have been rising since mid-March, but were also relatively stable over the past 2 weeks. Last week, 85 King County residents were hospitalized with COVID-19, the same number as the previous week. And that represents one person hospitalized every 2 hours, every day, all day. Our hospitalization rate, 3.8 per 100,000 per week, is double what it was in early March. Both the current rate and the total number of hospitalized people last week are about 1/3 the number hospitalized during the peak of our recent fall-winter surge. The greatest number of recent hospitalizations is primarily in the 40 to 69-year-old group, followed by 20 to 39-year-olds. Over the past week, more 20 to 29-year-olds were hospitalized than people over 70 for COVID-19. The increasing number of hospitalizations among young adults reinforces that although the rate of hospitalization is low in this group, when COVID-19 is widespread, severe cases will occur even in younger people. And COVID-19 can cause severe disease in people of all ages. The good news is that deaths have fallen dramatically since the peak of the fall and winter surge. On average, over the past week, 1 King County resident has died of COVID-19 each day, compared with 9 deaths per day during the winter peak. And although most of our oldest adults are protected through vaccination, not everyone is vaccinated. And when transmission increases in the community, the virus still can find its way to those who are most vulnerable and remain unprotected. Speak a little bit about the variants. Our Department of Health released their weekly report on Thursday. There are now at least 724 variant isolates of SARS-CoV-2 that have been identified in King County. And the state and laboratory partners are now sequencing about 10% of all cases. We have 443 cases recognized with the B.1.429 variant, the one from recognized first in California. We have 212 cases identified with the B.1.1.7, so-called UK variant, that's up 69. And we have 15 cases with the P1 variant that was first recognized in Brazil, and 7 cases identified with the B.1.351 variant first recognized in South Africa. So you can see we have a variety of these new, more contagious and somewhat more dangerous variants that are circulating in the county, and increasingly we're recognizing more each week. A bit about our exposure settings. We discussed this a little bit last week. I again want to remark on the tremendous statistic that we have not had an outbreak in a long-term care facility now for over 1 month. But people do continue to be exposed to COVID-19 in a variety of settings in King County at social events and non-healthcare workplaces and households. Nearly 40% of cases reported going to workplaces during their exposure period in the last month, and that's an increase from earlier this year. And 30% have cited attending family visits or group meals, parties, weddings, or other social events during their exposure period, which is also an increase from earlier this year. We've had 2 additional outbreaks associated with youth sports, bringing the total number of youth sport outbreaks in the last 2 months to 10. And as a reminder, the precautions taken during gameplay are just as important any other time kids and families are together, including transportation to and from games, the locker room, socializing before and after games, and when you're not playing. Now, last week, I mentioned that there was also an increase in the number of cases citing travel during their exposure period. And CDC updated their travel guidance to say that people who are fully vaccinated can travel at low risk to themselves. However, CDC and we continue to advise against non-essential travel due to the very high rates of COVID-19 we're seeing nationwide. Travel at this time poses a substantial risk for COVID transmission. However, if you do travel and you're not vaccinated recently, or I should say not fully vaccinated, get tested 1 to 3 days before travel and 3 to 5 days again after your trip, and stay home away from others for 7 days upon your return. If you don't get tested after return, please quarantine at home for 10 days. If you're vaccinated, no need to get tested before or after travel or to quarantine, but you should still monitor for symptoms after return and wear a mask and take precautions during travel. So to summarize our epidemiology, cases and hospitalizations are substantial and holding steady this week. The increases we've seen recently are likely due to the combination of increasing activities and the impact of more variant strains that together promote the spread of COVID-19. And we can't predict with certainty whether cases will rise, fall, or remain stable in the coming days. But with increasing numbers of more dangerous variants and our current level of vaccine coverage, along with increasing activities, we remain at risk for a serious outbreak. The relatively low number of deaths recently is a tribute to the effectiveness of vaccination in high-risk older adults, but it's important to prevent serious illnesses and hospitalizations from COVID-19 in all age groups. Now, clearly, the threat from COVID-19 will decrease as more people are protected through vaccination. But today, vaccination alone is not enough. We need to hang in with continued precautions for a few more weeks so that no one has to suffer from a preventable COVID-19 infection and its consequences. Abandoning COVID-19 prevention behaviors now is like sending the fire department away while the house is still burning. To protect yourself and those around you, wear a well-made, snug-fitting face mask, limit activities with unvaccinated people from outside your home, avoid crowded indoor spaces, and pay attention to improving ventilation in workplaces, businesses, and homes, including by opening doors and windows. Please remember COVID-19 spreads primarily through the air and often from people who do not appear ill or before they develop symptoms. And in King County, 30% of our cases do not report contact with someone known or suspected to have COVID-19. That is silent spread. Now to the phases. Washington State's Healthy Washington Plan, the roadmap to recovery, defines various phases related to reopening and sets the metrics associated with moving up or down a phase. To remain in current phase 3 eligibility, King County needs to maintain a 14-day incidence rate below 200 per 100,000 and a 7-day new hospitalization rate of 5 per 100,000. The state will be announcing their assessment of the metrics on Monday. However, King County has not crossed either of these thresholds as of today. We have, however, been trending towards the threshold since mid-March, and we need to be ready to adjust course if needed and move back from phase 3 to phase 2 if necessary. Now for vaccine. We passed the 1 million doses administered mark last week, and nearly 800,000 people in King County have received at least one dose. That's 100,000 more than last week. 45% of King County residents aged 16 or older have received one or more doses, and 27%, that's greater than 1 in 4, King County residents 16 or older are fully vaccinated. Among our older adults, 88% of those 65 and older have received at least one dose, and that's compared with 77% nationwide. And 72% of adults 65 and older have completed the series, compared with 58% across the US. For adults aged 65 and older across all racial and ethnic groups, we've passed 74% or higher vaccination coverage with one or more doses. Nonetheless, currently the percentage of white adults 16 and older who have received at least one dose continues to outpace most other racial and ethnic groups. However, we are making progress in our efforts to increase vaccine access for communities of color, and each week since February, the proportion of vaccine doses going to people of color has increased. And we continue to work towards closing this equity gap through tailored outreach, community events, encouraging providers to conduct outreach to establish patients of color and other activities. Here are a few examples of how we're closing the vaccine equity gap this week in communities of color. We've conducted multiple outreach activities to essential workplaces, including restaurants, manufacturing, and child care centers, focusing on South King County, our hardest hit community. Our outreach teams are working to ensure owners and managers know that their staff are eligible and help them secure appointments for their staff at our King County run vaccination sites and troubleshoot barriers to access. For example, we've helped assist in getting employees who did not have transportation to the sites. We've helped organize on-site vaccination clinics for employers, and we're holding ongoing conversations with community groups to answer any questions about vaccine hesitancy. We continue to also hold community-based vaccination sites, including a recent event in conjunction with the Congolese Integration Network, and we're working on upcoming events with the African American churches and Latinx organizations in King County. Our mobile vaccination team is continuing its work to vaccinate people living homeless, including those in permanent supportive housing sites, homeless shelters, encampments, and people living unsheltered. And we also held a vaccination event last week for homeless services staff and volunteers, where over 300 of those folks who work so hard with our homeless population were vaccinated. Now, with respect to vaccine supply, limited vaccine supply has been our #1 challenge to vaccinating everyone who's eligible and who wants to be vaccinated. So let me say that again to be clear. Limited vaccine supply has been our #1 challenge to vaccinating everyone who's eligible. I guess this sentence doesn't want to come out. Excuse me. Okay, let's try it again. Limited vaccine supply has been our #1 challenge to vaccinating everyone who is eligible and who wants to be vaccinated. Beginning April 15th, anticipating an increased vaccine supply, everyone 16 years and older will be eligible for vaccination to protect them from COVID-19. In King County, this means next week, almost 1 million people 16 and older will be eligible for vaccination, including 650,000 estimated to be newly eligible and about 275,000 currently eligible and not yet vaccinated. At the same time, Washington Department of Health has informed us that the vaccine supply will not be increasing as predicted over the next 3 weeks. For the coming week, at this time, we're expecting the vaccine supply to be about 2/3 to 3/4 of last week's, and less than what we estimated is needed to meet the demand of currently eligible people. The mismatch between supply and demand will make it harder for all who are eligible to get appointments as soon as we would have liked. We have had the capacity, the plans, and the partnerships in place to serve all who are eligible as soon as we have sufficient supply of vaccine. And we are committed to providing vaccines as quickly as we get them. At the same time, we do not want to sacrifice equity for simplicity. With whatever vaccine supply is available now and going forward, we will continue to focus on addressing barriers to vaccination and facilitating access to vaccine to those community members who are most impacted by COVID-19 illnesses, hospitalizations, and deaths, and who are most likely to experience barriers to securing appointments for vaccination. We're also asking community vaccination providers to step up their efforts to reach high-risk individuals this week, such as older adults and people with underlying health conditions and critical workers, before eligibility widens. This includes ensuring things like language access and availability of vaccine on weekends and evenings, and providing transportation to vaccination sites if needed, and sending mobile teams to low-income senior housing and to people who can't leave their homes. Now, I want to pivot to a different topic, an important topic. It's a public service announcement about our blood supply in our community, which is running dangerously low at this time, when blood use by our Pacific Northwest hospitals is increasing, and the demand is increasing beyond the supply of blood. BloodWorks Northwest is hundreds of appointments short of what they need to maintain a healthy blood supply. And not enough people are signing up to donate blood. And there's apparently confusion about eligibility to donate after one is vaccinated for COVID-19 that may be contributing. So I just want to clarify any misconception that it was unsafe to donate immediately after being vaccinated. There is no wait. to donate blood after receiving the COVID-19 vaccine, and donating blood has no impact on your eligibility to receive the vaccine. So finally, I'd like to acknowledge that this week is National Public Health Week, and I want to recognize the amazing staff that I work with, that I have the privilege to work with here at Public Health, and our public health colleagues across the state and the country, and also at University of Washington and the CDC. And I also want to acknowledge our King County healthcare providers, who we consider part of our community's public health system. In closing, I'm going to share a brief quote from Dr. Bill Foege. He's a renowned public health physician, epidemiologist, past director of the CDC. He led the smallpox eradication program, and he's a recipient of the Presidential Medal of Freedom and an all-around public health icon, who, by the way, also got his start working in public health at Public Health Seattle and King County. And the quote from Dr. Foege is, "There is no human endeavor that is outside the realm of public health." There is no human endeavor that is outside the realm of public health. In that context, I want to thank the public, individuals, families, all of our essential workers, business owners, community leaders, policymakers, and others, including journalists, because each of you have been doing vital public health work by taking actions to protect yourselves and to protect and support one another and our community in so many ways across all our human endeavors during this most difficult and unprecedented pandemic. And I also want to recognize those whose endeavors include working on social justice, abolishing poverty, improving access to education, fighting racism, violence, and discrimination in all its forms, and otherwise improving the conditions in which people live, learn, work, and play, because you too are public health. And with that, I welcome your questions.
Thanks so much, Dr. Duchin. Happy Public Health Week to you. For our Q&A portion, if members of the media have questions, please use the raise your hand function in Zoom, and we will call on you when it's your turn. Our first question comes from Keith Eldridge. Keith, please go ahead.
Dr. Duchin, I want to get your reaction to the governor's just announcing that now, in order to be pushed back to phase 2, you'd have to fail both of those metrics in hospitalizations and in cases per 100,000. What's your reaction to that change? And also, do you think that perhaps even though King County is okay this go around, that in 3 weeks you may have to move back a phase? And also, just to confirm that the effective R rate in King County is 2, which is pretty high.
Okay, three-part question. So part one of the new announcement about counties needing to meet or not meet 2 metrics in order to move back and forth. You know, these metrics are, they're empiric. You know, they're a little bit arbitrary. They're based on best judgment, expert opinion about, you know, what level of disease transmission we can, should, will tolerate in our community before we impose more restrictions on our activities. So there's no absolute right way or right answer to do this. The two tend to track together. I don't have a lot of anxiety about requiring them both to be met. I think if we ever encountered a situation where we thought there was a significant health threat to a county or a community, yet only one of those metrics was being triggered, we do have the flexibility to move our county backwards if necessary. So I think it's understandable, not unreasonable, and I think it's something that we can live with and manage and be flexible if necessary about going forward. With respect to whether or not King County will or will not hit that threshold, impossible to predict. You know, I really would have thought, based on our trajectory last week, that we would have crossed that threshold this week. But we have cases have plateaued, hospitalization have plateaued at a higher level than we would like to see them, but nonetheless, they've plateaued. Sometimes after a plateau, cases rise again, sometimes they begin to fall. It's very much dependent on our behaviors, how we interact in the community, the safety measures that we take in our homes, in our workplaces, and when we socialize. Hopefully we'll be able to exercise restraint for just a few more weeks as more people become vaccinated and the community realizes the benefits of vaccination on interrupting transmission. However, we're not there yet. We can't rely on vaccination alone at this point. We need to have both vaccination and effort in suppressing COVID-19 by individuals, by workers, by business owners, and everyone who manages a facility or otherwise is engaged in group activities. The reproductive number, I haven't seen the particular number you're referring to, but these are very delayed numbers. So they usually take about 2 weeks to calculate because the data they rely on are not timely. So my guess is that any R2 that you're looking at is 2 weeks ago when when the slope was rising, when cases were increasing. Today with our plateau, you would anticipate that that number has come down quite a bit, but we won't, unfortunately, because of the way it's calculated, we won't see it for another 7 to 14 days. We know what's happening in our community based on case rates, based on hospitalization rates. We don't need to look at the reproductive number to tell us there's too much COVID transmission happening and we need to step back and take it easy and just wait a few more weeks before more of us are vaccinated so that we can open up more safely.
Thanks, Dr. Duchin. Our next question comes from Elise O'Neill. Elise, please go ahead.
Thanks so much for taking our questions. I have two questions. The first is, what populations in King County were the Johnson & Johnson vaccines that we're now not getting supposed to reach? And is Public Health Seattle King County doing anything to ensure that those populations are being vaccinated despite the reduction in Johnson & Johnson supply? And my second question is, are we seeing an effect on hospitalization rates from the variants of concern yet, since some of them are perhaps cause more severe disease?
Mm-hmm. Yeah, thanks for those questions. With respect to the J&J vaccine, I would have to refer you back to our immunization program to know specifically if there were any cancellations this week. I don't believe so, but going forward, we know that J&J is going to be in much more limited supply for the next few weeks than had been anticipated. And whenever possible, we work with the provider and if the population is appropriate to use a different vaccine. However, overall, as I mentioned, our vaccine supplies at this point is decreasing below what it has been for the past 2 weeks. So in all areas, there will be fewer first doses available, which is creating the situation that we had hoped would not exist, where supply is less than what is necessary to meet the current eligibility. And now we're having large numbers of newly eligible coming on without a proportional increase in vaccine supply. So what that's going to mean is across all sectors, there will not be as much vaccine available as we would have liked, and that activities and vaccination events that we would have hoped would be able to have been put in place will not be possible until that supply is adequate. If for specific details on if any particular J&J events have been canceled or postponed, we'll need to get back to you. And the second part of your question was about variants and whether the rates of hospitalization are increasing due to variants. We're looking at this very closely, and when the group now that we're most concerned about, of course, are the young adults, because they're the ones who have been described elsewhere to be uniquely, or not uniquely, but particularly hard hit by the variants. The variants are so much more transmissible. They spread so much more easily from person to person. We know young people gather more frequently and more intensively, and they socialize more. And so lots of opportunities for these variants to spread in populations of younger people. And they, we know this B117 at least causes more severe illness, 60% higher fatality rate and more severe illnesses, higher viral loads. It's not something you want to acquire, young people. So please, if you have opportunities to protect yourselves and your friends, do so. The nonetheless, even though the rate is increased with the variants, and we are seeing, relatively speaking, more younger people hospitalized now, they're starting out at a low rate of hospitalization compared to other groups. So it will take a bit more observation to know with any certainty whether or not hospitalization rates in these populations are significantly changing. So hopefully by next week, I'll be able to provide you a little bit more certainty around an assessment on that. But I would say at this point, we're not seeing a major impact that we can attribute to variants. What we're seeing now is comparable to what we saw, for example, during the large fall and winter third wave, where we had many young people also getting infected with COVID-19 and being hospitalized and having severe illnesses. So we'll have to see where this goes. Again, we're very early in the game with the new variants. They're only now becoming more prevalent. And I think we'll increasingly feel the impact of their presence in our community, which will potentially mean many more cases and many more hospitalizations, and unfortunately, some number of deaths that would otherwise be preventable if we were able to maximize suppression of viral transmission as we vaccinate more people. So hang on for another week or two. Hopefully I'll have good news for you, but I think it's a little too soon to say anything with certainty about the impact of the variants on hospitalization rates.
Thank you so much. Our next question comes from Jasmine McIntyre. Please go ahead.
Thank you so much for your time and for taking my question. I have two as well. One, with Pfizer being the only vaccine that's approved for 16 and 17-year-olds and 16 plus being eligible starting next Thursday, do you anticipate more of an influx of Pfizer specifically to the state? And what will happen to those still seeking the vaccine, anyone they can get, as 16 and 17-year-olds flow into the system? My second question is, with the uptick in cases, we're seeing 9,000 people head to Mariners games. Do you think it was premature to allow big groups at outdoor sporting events?
Okay, first question, Pfizer vaccine. Currently, it is the vaccine that's approved for 16 and 17-year-olds. What will be the impact of more 16 and 17-year-olds becoming eligible? There'll be more people looking for a vaccine while the vaccine supply remains stable, or actually in our case, is decreasing at the moment. We are not expecting increases in Pfizer or Moderna over the next 3 weeks, according to the Department of Health. I hope that changes, but we're looking at best a stable vaccination supply overall, and certainly a stable supply of Pfizer for the next 3 weeks. So that will mean, as I predicted, more people trying to access a stable or potentially even lower number of vaccine doses. And that is why we're really trying to emphasize the importance of this week, everyone reaching out to those people who are currently eligible by virtue of a high-risk condition or being an essential worker or equity considerations, and going forward to the extent possible that we want to continue to focus this vaccine in an equitable way on those populations who are at highest risk of developing severe COVID-19 infections, being hospitalized, and dying. And so our King County sites will continue to focus on communities that have been hardest hit, and we're encouraging our healthcare providers to the extent possible. I can't predict exactly what's going to happen in the community, but we will be able to track it and report back to you on what happens. Was there a third part?
I think just two for that.
My first question was the double-barreled one. Sorry about that. I was wondering if you think it's premature to allow 9,000 fans into large sporting events.
Well, I certainly think it's advisable to avoid indoor gatherings with large numbers of people. That is where the highest risk is. Closed air spaces, and particularly closed air spaces if people are not wearing masks. Spending prolonged time indoors is still quite risky. It's actually more risky now than it's been previously, given the variants and how well they spread, and they do spread through the air. With respect to outdoor venues, it's not clear how much of a risk they pose. I think ultimately time will tell whether our reopening was premature or not based on where this outbreak goes. I think if we see a continued or a resurgence of cases in the county, um, I think it'll be a result of a combination of different activities that people are doing and bringing people in contact with one another. But whether outdoor sporting events play a major role in that, I think is very hard for me to predict. Certainly, sitting outdoors in an outdoor stadium spaced from other people is a very low risk thing. I worry more about the how people are getting there, transportation. Are they closed in cars with other groups? Are they packed closely together? Getting in or out of the venue? Are they socializing before or afterwards? Those are more likely to be where transmission will occur than being in an outdoor stadium.
Great, thanks so much. And just in our last couple of minutes, we have one more question. This one from Carolyn Bick. Carolyn, please go ahead.
Hi, thank you. Yes, so much. Thank you so much for taking my question. I wanted to ask, going back to something you mentioned a bit earlier, how many youths were infected in these two new outbreaks, the ones that were specifically traced to youth sporting events? And where were those events located? I wanted to know if they lined up with the heavily impacted south end of the county.
Yeah, thanks, Carolyn. Well, I'm going to need to get back to you with that information. I don't have it with me.
Sure, no problem.
Sorry.
Yep.
Yeah, our outbreak team can provide that to you. Gabriel, are there any other questions?
No other questions from media.
Okay.
So if you had any closing remarks?
Yes, just briefly again, thank you everyone for your continued participation in these conversations. I really just want to remind everyone how quickly this virus can move and how hard it is to slow once it gains momentum. Until enough of us are vaccinated, we need to prevent the spread of COVID-19 where we work, where we socialize, in our personal lives, in our homes, our businesses, and anywhere people gather. As more of us are vaccinated, the risk will gradually subside, but it's not an on-off switch. So we need to work together for a couple more weeks on preventing COVID transmission in the community. And I believe by sometime in May, the risk will have greatly diminished. So thank you again, and I look forward to talking with you next Friday.
That concludes today's briefing. Thanks so much for joining us, and have a safe weekend.